What's up, you guys? It's your girl Flawless K here, and welcome back to another freaking video. On today's video, we are talking all about hemodialysis and what it means and what it's like to be a nephrology nurse, as I am myself. But before we get into this video, don't forget to like, comment, and subscribe to your girl's channel for more great content. So without further ado, let's get into the video. So I decided to make this video because a lot of people aren't very educated on what hemodialysis is and about people with chronic kidney disease, what nephrology nurses actually do. For me myself, I wasn't too educated about it until I got into the profession within itself. So I'm gonna make a video for all you future technicians, nurses, or doctors who may be interested in hemodialysis with themselves. People who are on dialysis suffer from chronic kidney disease or acute kidney disease. So if you have acute kidney disease, then you may be able to regain kidney function in the future. But if you have chronic kidney disease, then you can't. You have, like, your kidneys are fully shut down, so you have to rely on dialysis. So what your kidneys usually do is, your kidneys have seven major functions. Okay, so it helps control like the acid-base balances in your body, the water balance, and the fluid that you take in your body. It helps with your electrolytes, helps remove the toxins in your body. That's why you urinate. Okay, it also helps control your blood pressure. Yes, your kidneys help control your blood pressure, you guys. It also helps you make more red blood cells in your body. And lastly, I don't know where I was at, but lastly, it helps with your vitamin D metabolism. So those are kind of what the kidneys are used in your body to help do. So if you have kidney function, then all of those things are really out of whack. So there are several different types of ways that a patient can have dialysis. They can have hemodialysis, which they can have in their home. So you can be a home nephrology nurse, where you go to the people's home, you help them set up like a little machine in their house, and you do your dialysis that way. Or you can do hemodialysis in a center, which is an outpatient center, which is somewhere I work, where you go and you sit in a chair and you have this big machine that you get hooked up to, and you have your dialysis that way. You can also have PD, which is they insert there's like a little, I'm not really 100% educated on PD and how that works, but I know that you have like a cord that goes into your stomach through a lining, and you get like a drip bag, and that is used to like help pull some of the fluids out of the body as well. And if I'm missing any other type of form, then I will just probably put it up here. But people can also get dialysis in the hospital. That's where you have your acute care nurses who goes and travels to these different hospitals to help give and dialyze patients who are in the hospital. And that's where you have your acute nurses, your home hemodialysis nurses, or your outpatient in-center hemodialysis nurses. So when you do, for patients who have kidney failure in any type of way, acute or chronic, they have three major ways of how we would pull the fluid from their body. Oh, well, first of all, let me explain what we as nephrology nurses do. So with dialysis, do two major functions. We help balance the water in your body, and we help remove the toxins from your body. Those are kind of like the main functions of what dialysis does for a patient. So you can receive your treatment from three different forms. One, people usually have a central venous catheter, which we put in your chest, that's connected to your heart. There's a whole bunch of how that's done, but that's a whole different other video. So you can have a central venous catheter, or you can have an AV which is where we connect an artery and a vein in your arm or your leg or wherever they decide to put your access, which is usually in your arm. Well, we connect an artery and a vein together to form an AV fistula, or we also connect it's the thing called an AV graft, which is we use a piece of like synthetic material to connect your artery and vein together to this synthetic piece of material in your arm, and that's what we call a graft. And sometimes people can have these big old horseshoe grafts in their arms as well, or in their legs they can have a horseshoe graft, wherever they decide to put it. So those are the three main forms or things that you have to get done in order to have your dialysis. So you can have an AV fistula, you can have an AV graft, or you can have a CVC, a central venous catheter. Super important to assess their access. So if they have an AV fistula or an AV graft, it's super important to take a listen to it, you know, and make sure that you feel the thrill, you're hearing a brewery before you stick them, because there are certain things that can cause like problems with their access, like stenosis. If you hear some weird high-pitched sound that's like, okay, this is not normal, they may be getting stenosis. If they're bleeding a lot more from their access than normal, they could also be getting stenosis or some clotting. Some people, you may not feel no thrill, no nothing, and they could be clotted, which is not good as well, because how can we do a run your treatment if your access is clotted? So that's where we send you out to IR to get that. So what happens is you sit down and we stick you with needles. Nurses or technicians, we usually use about a 14 size gauge up to, I want to say, a 17 size gauge, right? Yeah, so we use about a 14 to a 17 size gauge. In my facility, we usually use like a 16, 15, or a 14, I believe is what we have in my facility. That's just my facility. But we do stick you with these needles. You get 2 needles. One goes into your arterial, one goes into your venous. So from your arterial, what we're doing is pulling the blood, and the venous is pushing the blood back that has been cleaned and rinsed and cycled. And that machine, by its spinning and doing its pulling, we're helping clean your blood, get rid of all the extra fluid that you might have in your body, essentially. So that's what's happening when you're on dialysis. So for nurses, the most important things to do when you are monitoring and assessing your patients, we always like to check for fluids and edema. Edema. Mainly goes for people who work with patients who have chronic kidney disease, because their body is not able to filter out a lot of fluid. Some people who have chronic kidney disease don't urinate at all, or they urinate just a little bit. So what happens is their bodies, they're gonna restore all that water. So we mostly check for edema in their legs. They can have swelling in their faces, swelling in their arms. We mostly check the legs. You really want to check for swelling in the legs. That can help determine, does this patient have a lot on, or does this patient, do we need to take more fluid off this patient for today? That also reminds me that we as nurses have this thing called an estimated dry weight. This is a weight that the doctor comes up with somehow, some way, that shows that this is the appropriate weight that we need to get this patient to every time they come to dialysis, that won't cause their blood pressure to crash, that won't cause them to feel tired or have cramping during their treatment if they get to this estimated dry weight. We as nurses, we evaluate this. If we feel that the patient is gaining weight and their dry weight may need to be adjusted, we as nurses are able to adjust this dry weight if we feel that it needs to be done, and we can also talk to our provider about it. I know for us, we are able to adjust it maybe 0.5 to 1 kilogram lower or above their dry weight without referring to the doctor. But if you want to change it more, then you should definitely talk to your doctor about doing that. So also, while we're assessing, it's super important for nurses to assess fluid in the lungs, because you know, some people don't get fluid buildup in their legs or in their arms or in their face. Some of them get a lot of fluid buildup in here, which can cause a lot of your patients with chronic kidney disease to have shortness of breath when they come in for their treatment, because they're carrying all this fluid. And sometimes if you have too much fluid in your legs, it's like, where else can I go? And then it hovers in this area and section. So we also take a listen to the lungs. A lot of patients can have decreased lung sounds or crackling sounds or rails or wheezing in their lungs when you take a listen. I think the most common for me is what I've heard is like decreased breath sounds, because people come in with so much water and so much fluid that it's all in this area, and when you tell them to take a deep breath, you're like, is my stethoscope working? Do I need a new stethoscope? No, honey, your stethoscope is working. Your patient just has decreased breath sounds, okay? All right. Also, you also want to monitor your patient for cramping. Oh, cramping is like one of the biggest things that a lot of our patients go through. Cramping, when you're pulling all that fluid out, either maybe pulling off too much for the day can cause cramping in the muscles, or just pulling it off too much too fast can cause a lot of cramping and your patient. So definitely monitor for cramping. Blood pressures. This profession is the only like profession that I've seen blood pressures be off the chain. Off the chain. Like, don't be alarmed. You have to just get used to seeing blood pressures in the 90s or blood pressures in the 200s, and your patient's just sitting there chilling watching TV, and you're like, are you okay? And they're like, yeah, I'm great, I'm fine, what's the problem? And their blood pressure is like 208 over 156. Yes, or their blood pressure is 96 over 58. Yes, that's okay. Some people, their body has gotten used to it, and they can have hypotension or hypertension during treatment. Hypotension is very common. I won't say very, okay, let me start this over. Hypertension is very common in people who have chronic kidney disease, because the hormone in the body, the renin, is what we use to control the blood pressure. It's kind of like all over the place, so it causes your blood pressure, people who have chronic kidney disease, their blood pressure to spike and go up. But when they're on dialysis, we're pulling all that fluid and pulling everything that can actually cause their blood pressure to go down, and they can just crash. So people passing out during their treatment is can be a thing, and it can happen. It can be a very scary thing to someone who is very new to hemodialysis. But once you work with your team, what we usually do is try to rinse them with fluid, you know, lay them Trendelenburg with their feet up. We lift their feet up, and definitely want to give them oxygen. And usually with fluid, good fluid replacement, it can help bring that patient right back. Like, oh, what happened? Oh, you just passed out. So don't be alarmed if that happens. But that's why, as nephrology nurses, it's super important to monitor people's blood pressure during treatment. Other signs and symptoms that you will be looking for is like nausea and vomiting due to disequilibrium in the body, and we're just we're pulling all that fluid out too rapidly, and we're messing with things, and it's causing the patient. Okay, so let's get into some medications that we give to people who have chronic kidney disease. So some of the medications, I'm just going to talk about the most common ones that I do give as an outpatient hemodialysis nurse. So a lot of medications that we like to give is erythropoietin, I don't want to say that wrong, okay, or like Mircera or Aranesp, Okay, so these few medications that we give is to help boost people's production of red blood cells in their body, because one of the main labs that we do like to check is their hemoglobin. Okay, we love to check the hemoglobin to make sure it's between that nice healthy range. If you have a low hemoglobin, like below 10, in the 9s or in the 8s, that's really bad. That's not good. We don't like to see those numbers, so we do give Toxin or Aranesp or Macera in a dialysis center. Also, we give calcitriol very often, which is just vitamin D, because, you know, like I said, chronic kidney, the kidneys, we like to help stimulate that vitamin D. We also give Hectorol, it's like a IV push medication. We also give Sensipar a lot, and we give and we also give Sensipar. We give Venofer a lot, which is just iron for people who are anemic or become anemic due to having chronic kidney disease. We also give Parsabiv. That's to help control the PTH in the body, the parathyroid hormone. And yeah, Retacrit. We also do give Retacrit as well sometimes. Antibiotic wise, vancomycin is probably like one of the biggest antibiotic that we give. We also give 2 other antibiotics, but you know, I'm not gonna go too deep into that. Just know some of the most important ones. So as far as labs, we really closely monitor people's hemoglobins. We also monitor their potassiums, okay? Because the potassiums, like I said, when you have chronic kidney disease, you're not really able to regulate those electrolytes in your body. So you can have really high potassium or really low or high phosphorus. Like, so we really want to make sure that we look for that potassium. We are monitoring the calcium in the body as well. We check for their hemoglobins. And there's just a lot of different other labs. Their PTH, their yeah, just a whole bunch of different types of labs that we monitor for as nurses to make sure that our patients are well, good, and kept up for. Some other good tips as a nephrology nurse is patient education is super important sometimes, because you have those new patients who are still kind of very in denial about what's going on and what's going to be their new reality as far as their treatments. So it's good to educate people on just how to monitor and manage their fluid. I still have patients who have been doing dialysis for like years, like 6 years, and they just refuse to stop drinking water. And you know, they want to come into dialysis and take off 5 kilograms every dialysis treatment, which so it's just definitely good to educate them on, you know, balancing that fluid so that it can help them not be short of breath, preventing us to take off a lot of fluid during their treatment, and also just keep up with some of the foods that they're eating to make sure that their potassium levels aren't high and their other electrolytes are good. And with overall, I think I've hit most of the main points about dialysis and about what we do. So I hope that this video was just very educational to you all, and if you do have any questions, feel free to comment down below. I will answer any question that you have or direct you in the right direction. I hope you loved this video and enjoyed it and got some good insight on what the heck hemodialysis is and what the heck it means to be a nephrology nurse in the first place. And I hope that, hey, maybe you've become more interested in doing it and you join the team and become a nephrology nurse as well. So don't forget, once again, to like, comment, and subscribe to my channel, because we are dropping dimes all over the place and you don't want to miss the next video that I upload. And I will see you guys in my next video. Bye, guys.